Hi, my name is Stacy King and this is my lungs, thorax, and abdomen assessment video. My videoer is going to pan the room. Okay, and I'm going to get started. Knock, knock, knock.
Come in.
Hi, my name is Stacy and I'm going to be your student nurse today. I'm just going to provide some privacy. I'm going to wash my hands. I'm going to put on some gloves. And if my bed worked, I would raise my bed up to working height. Hello, can I see your armband? Can you tell me your name and date of birth?
Easton King, and I was born on May 27th, 2011.
Okay, I need to do a lungs, thorax, and abdomen assessment on you, Mr. King. Is that okay?
Yes.
Okay, I'm going to start by asking you some questions. Have you had a cough?
No.
Any shortness of breath?
No.
Do you smoke tobacco products?
No.
Okay, while I was talking to my patient, I was inspecting him. His respiratory effort is nice and easy. He's not struggling to breathe. His behavior is nice and calm, and he is on room air. He does not have a nasal cannula or an oxygen mask. His skin is appropriate for his ethnicity. It has nice pink undertones to it. And now, Mr. King, can I help you sit up? I'm just going to swing over to the side of the bed and just sit nice and straight for me. And I am just looking at his thorax, and it is nice and symmetrical, and his spine is nice and straight. His scapula are symmetrical, his shoulders are symmetrical. Can you put your hands out to the side? And I'm just going to check his AP ratio. I'm going to look at the front. I'm going to look towards the side, and his side is half the distance from the front, so I know that his AP ratio is 1 to 2. You can just relax your hands down. I'm going to place my hands on your chest if that's okay. Okay, I just need you to take a big deep breath. Okay, and now I'm going to do the back. Okay, take a big deep breath. Okay, and he expanded symmetrically on both sides. So now I am going to take your pulse, but I'm really taking his respiratory rate. And I'm going to take this for a whole minute. Okay, his respiratory rate was 18 breaths per minute. And now I am just going to listen to your lungs. It's going to seem like I'm listening for a long time because I have to listen to a lot of different places, but that doesn't mean anything's wrong, okay? Also, you don't need to take a deep breath, just breathe normally while I listen. Can you come film the front of, like, where my stethoscope goes? Okay, his lungs were clear to auscultation anteriorly on both sides, and there were no adventitious lung sounds noted. I am going to listen to the back now. Okay, there's a lot of places back here, Mr. King, so just breathe normally, okay? Can you look down for me? Okay, his posterior lung sounds were clear to auscultation, and there were no adventitious breath sounds. Now we're going to move on to our abdominal assessment. So if you could just lay down flat for me. The first thing I'm going to do is look at the contour of his abdomen. It is nice and flat. I don't see any abnormal lumps or masses or pulsations, and it's nice and symmetric on both sides. So now I'm going to listen to your stomach. I'm going to start down here in the right lower quadrant, okay? Okay, his bowel sounds are normoactive in all 4 quadrants. Now I'm just going to do some tapping on your belly, okay? And I'm going to percuss in a zigzag motion. Okay, any pain when I did that? There was tympany throughout, no dullness. And now I'm going to palpate. So I just want you to tell me if there's any pain when I press on your belly, okay? I'm just going to move in a zigzag motion, same way I did with the percussion. No pain?
Nope.
Okay, and I didn't feel any abnormal lumps, masses, or pulsations. Okay, Mr. King, that concludes my assessment today. Thank you for letting me take care of you. Is there anything else I can do for you?
No.
Okay, I'm going to make sure both of my side rails are raised. This bed is broken. I'm going to make sure my bed is in the lowest position. The wheels are locked, and here is your call light. You have your non-skid socks on. I am going to wash my hands. Thank you again for letting me take care of you. And that concludes my assessment.